welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Advanced imaging reveals undetected metastases in high-risk prostate cancer patients, study finds. A new study published in JAMA Network Open found that nearly half of high-risk prostate cancer patients previously classified as non-metastatic by conventional imaging actually have metastatic disease when evaluated with advanced prostate-specific membrane antigen positron emission tomography (PSMA PET) imaging, suggesting that traditional imaging may underestimate how far the cancer has spread in many cases. To better understand the advantages of PSMA PET over conventional imaging, researchers conducted a post-hoc retrospective cross-sectional study using data from 182 patients with high-risk recurrent prostate cancer who were thought to have disease limited to the prostate and were eligible for the EMBARK trial. Study unveils link between loneliness and higher risk of heart disease, stroke. A new research found that interactions with friends and family may keep us healthy because they boost our immune system and reduce our risk of diseases such as heart disease, stroke, and type 2 diabetes. Their findings are published in the journal Nature Human Behavior. A team led by scientists examined the proteomes, the suite of proteins, in blood samples donated by over 42,000 adults aged 40 to 69 years who are taking part in the UK Biobank. This allowed them to see which proteins were present in higher levels among people who were socially isolated or lonely and how these proteins were connected to poorer health. The team calculated social isolation and loneliness scores for individuals. When they analyzed the proteomes and adjusted for factors such as age, sex, and socioeconomic background, the team found 175 proteins associated with social isolation and 26 proteins associated with loneliness. Many of these proteins are produced in response to inflammation, viral infection, and as part of our immune responses, as well as having been linked to cardiovascular disease, type 2 diabetes, stroke, and early death. Researchers identified 6 biomarkers of kidney injury for improved patient outcomes. Researchers have identified 6 new biomarkers that could detect kidney injury faster and with more sensitivity, advancing safer drug development and improving health outcomes for patients. The findings were published recently in Clinical Pharmacology and Therapeutics. The research team examined urinary levels of protein biomarkers in healthy volunteers and patients undergoing treatment for a mesothelioma with a chemotherapy drug that is known to have toxic effects on the kidneys. The 6 biomarkers identified by the team are mostly made in the kidneys themselves in response to injury or inflammation. This enables detection of kidney injury more quickly than current blood tests like serum creatinine, which can sometimes take several days to reach abnormal levels. New nasal swab may detect specific asthma type in children. Researchers at the University of Pittsburgh have developed a nasal swab test for kids that diagnoses specific asthma subtype or endotype. The findings are published in JAMA. Traditionally, asthma has been classified into endotypes known as T2 high or T2 low based on the amount of T helper 2 inflammation present. More recently, T2 low has been split into 2 endotypes, T17 high, which has less T helper 2 inflammation and more T helper 17 inflammation, and low, which has low levels of both types of inflammation. Precise diagnosis of endotypes usually involves genetic analysis of a lung tissue sample taken by a procedure called a bronchoscopy, which is done under general anesthesia. For children, especially those with milder disease, it's not feasible or ethical to perform this invasive procedure, so clinicians have had to rely on imperfect tools including immune markers in the blood, lung function, and whether or not they have allergies. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.